Welcome, everyone. Thank you for coming. I'm Dr. Pam Schaff, and I'm the director of the HEAL program here at USC, and it's my pleasure to welcome you to our fourth show this year. Our art shows and the Hoyt Gallery are part of our new mission for our program to align the work of artist-patients with our core curriculum. So our year one students are studying neurosciences right now, and that's why our art, both by our guest artists as well as by our faculty and staff on the back wall, are all related to the neurosciences system. Our other mission is to help foster enhanced understanding between patients and future doctors and clinicians of all kinds. So we're really glad to have everyone here. I'm going to turn the rest of introductions over to Ted Meyer, who's our artist in residence, with the exception of a welcome as well to Dr. Helena Chui, who's our professor of neurology and chair of the Department of Neurology, who's going to join Ted and our artists in conversation. So I'll let Ted take over now.
Hey. So I put this show together because both of these photographers here deal with faces in one way or another, and their perception of faces is different than most people. So we have Jane Szabo, right? Yes. And
Fredric May, yeah.
So they will explain to you what's going on with them and why their perceptions are slightly different. But I'm going to ask a couple questions, because I always do when we get into this. So facial blindness, Jane has a form of facial blindness. So what do you guys think the percentage in the general population is of people who can't recognize a face?
1%.
Double it. 2%, which is half of color blindness. Color blindness is 4% and 8% in men. So it's not that uncommon, but most people don't really hear about it. How many strokes a year? What do you guys think is an average number? So Jeff had a stroke, and that's why his work is the way it is. So how many strokes do you think a year? 700, according to the Google machine, 795 strokes per year, and a third of those land up with some sort of visual perceptual problem afterwards. So it's pretty common. So let's start with our doctor here, our neurologist. So when you're a kid, every kid comes up with the question of, do I see what everyone else sees? Do I see blue the same way everybody else sees blue, or do I see red the same way everybody else does? And then here we have some artists that don't. So as a neurologist, when you're doing baseline tests and things, how do you find out if people are seeing things? And is this the sort of thing that interested you enough to become a neurologist?
Yes, I have wondered whether everyone sees red the same way I do, and I've never actually figured out a way to test that. So, but I can wax on about, as you know, about the ability to distinguish colors at the retinal level, the photoreceptors, and then the cortical representation of color, which is in visual association cortex. For color, there's the retinal, the photoreceptors, the cones, and may have problems there with inherited color blindness, like red-green problems. How many here have color blindness? Blue, no, especially, you mentioned 8% for males and 4% for females, so speak up. Okay, and then, of course, the visual pathways, as you've studied in neuroscience, go from the optic nerve to the chiasm, to the optic tract, to the lateral geniculate, to the Meyer's radiations to the primary visual cortex, and then from primary visual cortex V1 to association visual cortex, cortices, association visual cortices. You may not be familiar that there's a dorsal visual stream that goes to the parietal cortex. It's very important for reaching because it's vision to somatosensory position sense, and then there is a ventral visual stream that goes from primary visual cortex to the inferior temporal lobe, which is very important for color and for faces.
All right, so that'll bring up you. So we're going to go back to the artist, and then we'll come back to you in a second. So you guys are sort of interesting in that you both have these perceptual differences. You were born with it. You came upon it later. So first, the spatial blindness thing has always sort of been very interesting to me, and I keep trying to figure out exactly what it is you see. Now, and I keep thinking maybe like if you look at Jeff and I, do you not see a face? Or I think maybe it's like somebody who can't hear one tone from another in music, like you know that they're different, but you can't.
No.
What do you see? What do you see when you look at different faces?
First of all, I'll backtrack and say I don't know that I was born with it. My earliest memory of it probably goes back to my 20s. And I did do some reading, and it said it could be resulted by head trauma. And I did have an incident when I was about 15. I didn't even know I had a problem, except for one incident I remembered where I just basically decided I was socially awkward, and I just didn't know who people were. But my husband figured it out when we were watching movies, and he said, "You don't recognize who's who in these movies, do you?" And I'm like, "No, I can't tell the three men with short black hair. I don't know which one's which. I see each and every one of your faces. I see eyes. I see nose. It looks normal. But if you leave the room and you come back, or you ask me, what did so-and-so look like, I may not be able to describe their face. I recognize people and my friends because you always have your hair in a ponytail, you always dress a certain way, you're a certain height and a certain build. I know it's Ted. If Ted shaves his head and wears a different type of wardrobe, I may not, and I say Ted on the street, I probably won't know it's Ted. So we create methods of coping that I'm very good at recognizing tone of voice, wardrobe, hairstyle, and body movement. How somebody walks into a room becomes signifiers to me to identify who they are.
Okay, and then we'll get back to how that fits in your art in a second. So talk to us about what you see. So you had a stroke, and so...
Yes, my original stroke is what caused my... and I need help from my better half over here, Lisa Hammer. What do I have?
Homonymous hemiopsia.
Okay.
Hemianopia. It's spelled correctly. I'm just pronouncing it in Chinese.
It's been 6 years, and I yet to come up with it. I had a ascending aortic aortic surgery right here, and during that surgery, perioperative, I had a stroke. And it was undetected until the next morning where I was awake and everything was just kind of different in this area. And I figured it was the drugs, that was all. And I didn't really have a complaint about it. I felt I knew what was going on. And then when I mentioned, would that come back, and then that caused the issues, it proceeded from there. That's just how I discovered that. And then my vision is impaired by about 46% in both eyes. So in reality, I feel I can see just fine, if you were to ask me. As I told them in ICU, I got this. And so it just digressed from there because I feel I can see fine, but it's really a blur, and my vision is based on my memory perception of what is like in the room. One of my most comfortable rooms is my dark room because it's only 9 feet square. My brain remembers that real easy. I can feel my brain actually calm. I get kind of I don't know, did I go too off the rails there?
So for the neurologists here in the room, the history sounds like it's both visual fields. We've heard it's a homonymous hemianopia. So, and frequently the person will say it's their eye, but we have to separate. Can I test you a little bit here? May I just test you a little bit?
Sure.
Okay.
It might not be covered by his insurance.
Do I need to turn around? Yeah, and do I need to get my card out or anything like that? Yes, just straight to you?
Okay. Can you, okay, so what do you see right now?
Okay, well, I'm also wearing corrective yoke prism glasses, so. What I see here, if I bring my hand in, it comes in there.
Now you see it. So you
Yeah.
don't see it out here at
No,
all.
no.
You see it okay over here?
Oh, yeah,
Okay.
yeah.
Okay, so you have a right homonymous hemianopia. We don't know about the homonymous yet. Let me ask you to hold this for a minute. Thank you. Could you cover your, does it make much difference whether you're wearing your glasses or not?
Yes, on several different
Can
levels.
you just take them off?
Yes,
Here
sure.
We'll be both blind. Can you cover your left eye with your left hand, with the palm of your hand? Okay, now, can you tell me when you see my finger moving?
There,
Okay?
there,
Okay, now cover your other eye, your right eye, and we'll do it again, all right? Tell me when you can see my finger moving.
there, there.
Okay. So he has a right homonymous hemianopia, right? Because it's the same in both eyes. That's the homonymous part. So it would tell us that there's a problem with something behind the optic chiasm in the left side of the brain. So it's probably, could be, since you look fine and your sensation is fine, you walk fine, you move fine, it's probably in the occipital cortex on the left. And it's probably, does it look any different, these two here? You can't see anything?
I can't see them, no.
You can't see anything. So it's very dense?
It's a blur. It's a colored blur. It's a
Okay,
colored
let's
blur.
try this.
That's why I think I can see
Okay,
things.
Can you see any movement?
No. I couldn't see a train if it came. There
Oh,
it
okay,
is.
so it's more than a blur over here. It's very dense.
Yes.
And so it's affecting both the upper and the lower calcarine cortex, most likely on the left.
Yeah, my
Yes.
visual field test looks like 2 half circles. Yeah.
Yes. Oops, that's all right. Don't need a pen here. So what would happen with the pupil? It should be fine. The pupil should be fine. So I didn't bring my light, but if you yeah, and we can't because it's homonymous, so it would be coming the other, so the pupil light reflex should be okay. But if he were blind, if this had affected both calcarine cortices, what would happen to the visual cortex? In other words, if you couldn't see anything on either side, you had a right homonymous hemianopia and a left homonymous hemianopia, which could have occurred if there was hypotension or something. Then
use your mic.
what would happen to the pupillary reflex, the light reflex? Who will say it will be absent? Who will say it will be present? If this is cortical blindness, if this is, which you don't have, who vote for pupillary reflex would be absent? Okay, and who vote that it would be preserved? Yeah, so this is the majority, and this is correct. Why? Because the pupillary light fibers get off the bus at the lateral geniculate and they go to the midbrain. So if there's a problem in the back, it doesn't affect the pupillary light reflex. All right. Then, so he woke up with a blur, and it's kind of, now you have, your brain has, I would say, adapted to the fact that you've lost the right side, and mentally you just, you're smart, and you probably scan over. Now I'm in your blind spot, aren't I?
No, if I turn my eyes to you, I can see you really
see me.
good. Yes.
Yeah.
Yeah. So
Yes.
my tell is to always keep
Yes.
looking to the
Yes, yes.
right over
So he
here.
does not have a neglect. He knows that
Yeah.
there's something wrong on the right, and he fills it in.
I do my best.
So, now that we know that you're not going to have a heart attack or something,
There was probably a little piece of
Ischemic cryptogenic.
some embolus that came off from the aorta, the
Most
ascending
likely.
aorta that went up the vertebrals. I don't know if it was the left or the right, went up the basilar and then went into the left posterior cerebral artery distribution.
It's only a tiny
and got
jump.
a little infarct. That would be my hypothesis.
right.
Okay. I'm looking at the other neurologist to see if there's concurrence. That's Dr. Joe.
So part of the reason, or the reason that we bring art in here, is so that you guys can see how an illness can sort of mainstream into someone's personality and can be a positive thing. You can take an illness or something you would think of negative and make some really beautiful things out of it. So I'm going to start with Jane here. So you and I were talking one day ages ago about the fact that you tend to shoot dresses without people in them. You have images like this, and I sort of made, without knowing the way you saw, the comment that you never had faces in your artwork, whereas a lot of other people would have faces. So let's talk about how maybe this way you perceive goes into your artwork.
I would say that I never intentionally even understood that I was doing that, and you pointed it out and said, because you have this condition, that's why you're making work like this. And I'm like, really? Gosh, I never thought of it. But it does make sense. And I know when I was shooting this, which was a project about different ideas, it was very intentional, like, I don't want to see the face. And I very purposely blurred it because I wanted anonymity, lack of identity. And those are self-portraits, that is me. But I didn't really know why I wanted it without a face. And only recently, even though I'm 51, have I kind of started to acknowledge my condition and start realizing that, yes, I don't see faces, so the face, faces don't hold a lot of value to me. It's not where I give my importance in a relationship with a person. It's not about their face. And so it kind of makes perfect sense that I didn't value it so much in putting it in my own work. In my mind, I thought, I'm just making it a more universal image that it can relate to anybody. But maybe it is about how I see the world and the face not holding that much importance.
Okay, so let me just ask this question since your partner is here. So when most people start dating and they do that, he looked in my eyes and we were like, gee. When you looked in his eyes, do you get that same reaction, or do you go home afterward and think, oh, his hair looked really good? And
well, I can answer that a little bit differently. When we first started dating, he had a beard and a goatee. After a certain amount of time, maybe it was years, he shaved. And he came over and I'm like, I can't kiss you because I don't know you. And it took me a really long time to feel comfortable with, like, it just felt like that's a different person. And it kind of weirded me out. And now it's like, okay, I've seen him both ways, so I kind of know he's going to look like this. But he used to have long hair, and he told me, I'm going to cut my hair off, and if you come home and there's somebody you don't recognize in the house, don't kill me. But yes, it was that first time he shaved, it was really weird.
okay, Jeff, what kind of work did you do before the stroke, and what exactly are you showing us here with all this work behind us?
I'm formerly a newspaper photojournalist and magazine photojournalist, and then I'd been working as an industrial filmmaker for the past 15 years. This work came based upon the day I left ICU. I was leaving ICU, where I started to have hallucinations. And the very first one was in the bathroom, where you walk in and this side became this huge Christmas tree with these pink things. And I was like, that can't be normal, you know? And but it was interesting. And to make a long story short, I told Lisa about this, and she told the doctors. They explained to me what it was eventually. So then I worked in the same subconscious, though, with getting to this point. These are animations of these very distorted faces that would show up in this part of my eyesight. Particularly if I was having a conversation with you, Dr. Chu, it would be animating right here, just completely. I can see through it, and then it would dissipate, and they become. They have a lot of the same characteristics, but different, and they change. So one characteristic jumps between the others, and I can't explain it. But I worked on this originally on an iPad, just kind of working and building imagery. I do that, and I had an old iPad 1 and an old Glitch app that was on there, and that's what I was using. And it wasn't until years later I realized that I was going toward this black area that you see, because it's really only the black areas, the rest of it is just see-through. The pastel part is just, there's nothing there, and that's, so it's really just the animating black parts. And it's called Charles Bonnet syndrome.
So
Yes.
does he have sort of a visual phantom limb syndrome, like his
Yes.
brain is making up?
Well, I don't know, but that's the thought that comes to me as a metaphor, that somehow the faces or the Christmas tree, those, that part of the brain is still there, and it's filling in to the missing visual field. And how to test that, I would think maybe a functional MRI be interesting
up,
to
we can do
see. With a functional, well, you do a resting state functional MRI. You look at the blood flow. You have to come up with maybe some task-oriented with a picture, and then just see what's going on. And if that doesn't activate something in your left ventral visual stream that's filling in like a phantom limb. So here, phantom limb, you know, is after an amputation of a limb. Happened a lot after the Civil War, and people would feel their legs still there. And so here, even though Fredric has lost the right visual field to incoming stimuli, there's connections to that visual field that are still there, and they're still getting activated as a phantom face.
So quality of life, other than not really being able to follow a movie and a little bit of awkwardness, has caused any problem for either of you guys? Because you both have sort of invisible illnesses. Nobody, or I won't even say illness, but conditions. So nobody can really tell if they're sitting on the,
Right.
you know, it's like when you're talking to somebody and they're like, oh, I'm deaf in this ear, talking to this ear. But you have the visual. So day to day, do these things cause?
For me, it's mostly the social awkwardness, and probably at least once a week and it could be somebody at work where it's like, I'm looking for somebody and I can't find them, and it's like, oh, he's right there. And I'm just not recognizing that's the person I'm looking for.
So does everyone at your work, did you make a statement one day?
I kind of am now. I mean, I don't make it to the entire room, but it's like when I clearly don't recognize somebody, it's like, oops, sorry, this is actually what's going on. And, you know, just parties and that sort of thing where I've gone up and introduced myself to somebody I didn't know, and they're like, we were just talking 5 minutes ago. Oops, you took off the scarf you were wearing. I didn't recognize you anymore. So.
And what about for you?
Mine's been pretty difficult, actually, up till recently, because I felt I was fine. That was the problem. And I've had 2 strokes. I had one in...
Great to me.
Well, thank you, but in 2015 I had another stroke, and then I had a TIA somewhere in 2014. I don't know, that one's kind of a mystery thing. And because of that, I kept feeling, oh, I feel fine. I know what I'm doing, but I kept failing at what I was doing, which was trying to memorize camera menus. I can't. I have no short-term memory, and it's like gone. So I was actually buying cameras, okay, and just selling them as I get them because I just couldn't remember how to use it. Yeah, that's my main thing. But that may have been after my second stroke.
So I'm going to ask the question. So your relationship, like you asked her the name of your illness. So are you more dependent
Very,
now?
very. She drove me here, and I sat quietly in the back seat.
Driving.
No, I don't drive. No. However, I understand most people do.
Well,
So how, neurologically speaking, so in his case, is the brain still pretty malleable? Is over time, will things start to move around, other parts of the brain take over, or is that dependent person to person?
so this falls into the neuroplasticity category of question, and I think the plasticity of the human brain is considerable when we're very, very young, but by the time we're adults, there's limited. I remember a colleague who would explore this in some of our, in in apes, non-human primates, that were, I'm thinking IRB, you could do to see if there was an injury to the visual cortex, how much plasticity came back. And I remember him saying it's fairly limited by the time once in adulthood. So but this is a very open field now about neuroplasticity, and we don't want to, especially for this generation, your generation, I don't want to say anything because you're going to prove me wrong, about what can be done to reopen neuroplasticity. We're very interested with that. We know that after an injury, there's a period where the brain is trying to come back. We say that there are glial reactions that actually close the boundary because the glia are trying to prevent something that's injured, but maybe we could keep it open, and then with stem cells or with stem cell knowledge of what the milieu needs to be, and with entrainment, because there has to be experience, we could push the boundaries of neuroplasticity.
Okay, so we're gonna change your job to an art curator here. So looking at this work, you know, does this work speak to you for the conditions? If you hadn't heard them speak, would you be able to look at this work and guess what was going on with these guys?
No, I wouldn't have. I'm totally learning here. I mean, now that I know, I can see that there's this vertical meridian here, which shows that just the split between the left and right field. So, but I'm learning a phantom. You mentioned it, the phantom vision, the phantom face, and then I would like to hear, Jane, what you're showing here with the deconstruction there, and then the emergence of the person or what. And I have prosopagnosia, which is our term for lack of facial recognition. Visual agnosia is a more generic, because you can also lose your ability to, do you have any difficulty recognizing cats or dogs or horses or other things?
I don't think so, and I'm really good at object recognition. So I'm super aware of my environment in terms of like, oh, that house has new shutters. I mean, I really see that signifier.
That cat looks like a horse.
Yeah.
Yes, so it's, you don't have what we say visual agnosia, you have a very specific prosopagnosia, and Oliver Sacks wrote a book called The Man Who Mistook His Wife for a Hat.
Yes.
I mean, and facial recognition is a bilateral representation, so if we just were to, and it's in the ventral visual stream, the lingual and fusiform gyri, if you want to go back and look, and if you just damage one side, like in Fredric's case, it was just the one side, one would still preserve the ability to recognize faces. You have to have a loss of both inferior visual streams, both lingual and fusiform gyres, to have prosopagnosia. So this is, you're also an enigma to me. I'd love to see MRI scan.
Well, you guys both have some fun coming up for you guys now.
Set that up.
I'll volunteer as well.
Me? No.
Well, if we were at the other University Park campus and at the Dornsife Imaging Center, my mentors, Antonio and Hannah Damasio, who lead the USC Institute for Brain Creativity, would have the performance in the auditorium, and then I just imagine taking you next door right for your MRI scan. But please explain.
Well, this project, in my mind, had nothing at all to do with propagnosia, and it was really about issues of control and order. Just to give you background of what the work really was about, I was at a place in my life where I'm like super type A, and I want everything alphabetized, organized, charted grids, sorted, stacked, perfectly lined up, and my life was so busy and chaos that, you know, the papers are falling off the table, and I just couldn't keep up with life. And I was just trying to visually illustrate that intention to sort of put order and to manage one's environment. But the reality is, you know, my lines, even that order is chaotic and irregular. and ultimately that structure breaks down, and it was sort of trying to come to peace with my own inability to create a perfectly controlled, orderly life. I'm realizing life is busy and we can't be perfect all of the time. But I would, if I could just ask one question of the doctor, because trying to figure out, is this condition genetic or is it trauma-based? How does one determine that? I was kicked in the face by a horse when I was about 14 or 15.
Or a cat.
Or a cat. It looked big for a cat. And it did knock me unconscious, so I have a gap of time between when it happened and waking up in a hospital. But it took many, many years to even realize I was having this facial recognition problem.
Yeah, the MRI, we can usually after a trauma, like a focal cortical contusion, we could see that on an MRI. We would look at both T2 weighted images to look for some increased hyperintensity from a glial reaction, and then we would also look at the T1, especially at these areas. If this was developmental, we would look at those same areas. And again, in a functional MRI scan, we would look what's happening when visual images are, you're exposed to images like seashore or houses or whatever, and see what activates it, and faces, what activates. So we do have tools now to try to answer your question.
And I think I do actually have an MRI, brain MRI from a different situation. I'm going to try to dig that up and see if I can't send it to you.
And for Fredric, I hope you have no more TIAs and strokes, but just the comment would be memory. Memory is in the hippocampus, and it's also the hippocampus, the posterior 2/3 of the hippocampus is fed from the posterior cerebral artery, which is right nearby. So I wonder, that would be another area to look at, the hippocampus, in terms of, but I'm like you, I can't learn the menus on my camera.
Well, and that's how my project came about, was that you mentioned neuroplasticity, and I don't know if this is true or not, and I only speak to my situation on this, is that neuroplasticity to increase, if you can solve a problem using every faculty at once, you're probably doing better than just reading it off a screen. Okay, so that's what I do. So these are literally brought to even a woodworking end that's not even seen here yet. So I build it into a three-dimensional object from the digital idea.
Yeah. Well, I think it's amazing how both of you have taken this, which is, do you consider these disabilities or not?
Inconvenience more than disability, I would say.
Not really. It's worked very well for me, actually, but I've learned a lot about how my brain works, more so, and that's been more valuable, and how to learn things better without, like I used to. I'm not able to learn things in the same manner.
Are you still a photojournalist?
I'm not, no.
But you went to a different side.
I work in fine art only now, so that's all I do.
So does anybody in our audience have any question for our esteemed guests here?
I have a question. Can any neurodegenerative disease cause this?
Well, in Alzheimer's, which is my specialty, yes, we see a loss of memory for faces, and we test it, with facial recognition tests and show faces, and then a few minutes later after another task come back and see if people can remember the faces they saw before. And but this is a progressive condition, and it affects many other things as well, but the neurofibrillary tangles get into the inferior temporal lobe relatively early on. Then for hallucinations, in many of the disorders like Lewy body, with alpha-synucleinopathy, visual hallucinations are very prominent, and We don't entirely understand them, but we can see an association with decreased glucose metabolism in the occipital lobe. So we can see them in those two neurodegenerative conditions.
So given how focal Jane's deficits are, that they're related only to the face and that it would be like a bilateral issue, does that point more to genetic because you would expect to see additional deficits if it had been trauma? Or is it not possible to say?
Good question, and not possible for me to say.
Hi, this is for Jane. So Jane, how about your own face? Do you recognize your own face or?
Yes, because I don't change my hair. I definitely have seen pictures of other people, and I thought, like, that could be me. You know, it's just, I see me every day, so that helps. People that I see every day is easier for me to recognize, but again, I know how they're going to present themselves. But it's also, if I see them in a place that I normally see them, I expect them to be there, so I'm sort of looking for them. You start getting people out of context, and dressing and presenting differently is where I get into problems.
I have a comment. I've been to all of these art shows. I'm one of the team that kind of coordinates with the artists. But I'm noticing today that because it's about the brain, because this is the organ that our identity is seated in, our questions today are very, interesting and geared towards identity and who you are and, what this does for you in your life and how it's affected you. And they're much deeper seated, at least for me, as I'm watching. And I think we're all very morbidly curious too. But how does this make you feel, like this questioning?
I love that you used the word identity because I never really thought about that. But almost every single project I've done, I think of as self-portraiture, and I'm specifically dealing with identity issues. But my self-portraiture never really shows me. So to me, a self-portrait could be a photo of an object, because identity is in, to me, stories more than it is what we look like. Thank you.
For me, I just want to say for me on that, I'm legally blind, but I don't identify as blind. I identify more with brain injury or stroke. Because as I said, I can see just fine.
And do you recognize you? That's great.
And this point is true because none of us have 360-degree vision. We only have maybe 180, so we also have a homonymous retro hemianopia. All of us do. None of us can see at the back of our head, and we're all fine. It is relative.
Good afternoon. Question for you, Jane. Do you recall having facial recognition issues before your accident at 15?
No, and I don't. The only place and time I really remember it happening, or the first incidents, I was probably in my early 20s, and I went to a party of somebody. It was her new home, and she wasn't there. And it just seemed so strange, like, why isn't she here? And I was really troubled by it, but I didn't understand what was happening. But then it was like a lot of people were saying hi to somebody, and I was like, well, that seems like it's her, but it's not her. And it just didn't make any sense to me. And she had probably cut her hair or something, but I never really kind of figured out this is a problem. I just thought, you're kind of weird. But I'm sure it was her, and I just never believed it. And then I just never really realized I had a problem, and life went on. And probably maybe 5 or 7 years ago, my husband figured it out for me. But I still didn't really believe it. It was just like, no, it's just sort of, I'm just not good at it. It just didn't seem like a clinical condition. And only in talking to Ted did he sort of encourage me to look more deeply at it, and I took some online tests, but a lot of them had to do with celebrities. And I'm like, well, I don't recognize celebrities, so that test doesn't matter because, who knows what Matt Damon looks like? I don't know. I don't pay attention to that. So I kind of discounted that too. And then through this exhibition, got connected with a proper neuroscientist that I actually had to believe. And he's like, yeah, you got this problem. So now I'm kind of owning it in a way that maybe I hadn't before.
Hi. I am a social worker in the neurology clinic, and identity is one of the issues we address because when you have a radical diagnosis, it can change your life. But it's interesting to hear you talk about your own identity really isn't connected. You see the world the way you see it, and that makes it fine. But I'm curious about your resiliency and how the art plays into that, because so many people have a hard time adjusting to change. And it sounds like you both were so fluid in just meeting what showed up. I'm wondering where the art fits there, your identity and your expression of
Lisa,
yourself.
how fluid was my transition?
I'm sorry, I came in a little late, so maybe I missed the early part.
No, you were. Yes, it's true.
You just kept assuming you were fine.
Yes, and you're not.
Yeah.
And it took me until 2015. They wanted to do a baseline, so they did a psychological evaluation of me. It was all these battery of tests. I learned so much from it. It was amazing. And I mean, and some of those learning disabilities or whatever could have been in there for a long time. And I'm just going, oh, look at that. And then I did, one thing I wanted to ask, I did exceptionally well in verbal math. And they said, well, you might have a history of being good in verbal math. Well, I don't. And does that change?
Well, this is interesting because I'm thinking of frontal temporal lobar degeneration, which can be associated with prosopagnosia, and actually it's not seated in the lingual and fusiform drivers, but in frontal temporal dementia you get prosopagnosia from degeneration of the right temporal pole, so it's a different form of prosopagnosia. People with frontal temporal dementia become super artistic, and so you become very great at verbal math. You mean story math problems? And
okay.
So it's a similar sort of situation. So is this something that was always there and then just became uncovered, or how did this happen? It's fascinating. So some of the frontal temporal patients, they may become prosopagnosia, but I remember one took Bolero and put it into a visual montage, made that transformation from the auditory into a visual, or other ones that started to become very artistic. It's interesting when one part of the brain changes, what else might appear.
All right. Unfortunately, I think we got to wrap it there because everyone seems interested in this, but time is time. Before we stop, we also have some other artwork in the back by some faculty and students. Is anybody here who has artwork on the back? If so, stand up and raise your hand. We do not. Okay. Anyway, thank you guys. Pam will give our closing comments.
Well, first of all, I just want to thank both of you so much for your work. And Dr. Chu, that was just wonderful, a lesson as well as a wonderful conversation. I just want to comment that I think this, to me, represents one of the best examples of why we're doing this work. And I feel as if our mission to align our work with our studies with patient experience, what it does is it because of your artwork and the way you've talked about yourselves, as Dr. Rahman talked about identity, I think we have a way to understand our patients' experiences in a way that you've shown us. Your work puts that right on our walls, and we see it in a way we don't always see that. And obviously, we all talk about the ways in which we meet our patients where they are. We have conversations. We try to understand who they are. But you've put that on the canvas, so to speak, and really sort of transformed my way of thinking about how we can best learn about our patients. So I thank you both very much for that. Thanks for all being here.
Thank you. Thank you.